My bad. There are not two. There are three muscles. Three muscles on the neck. So we're going to start describing these three muscles from superficial to deep. Okay? So from the muscles that are closer to the skin to the muscles that are closer to your bones. Okay? So let's start off with the platysma. And platysma is it's a sheet of muscle. It's a muscle that originates right here on the fascia. I will show you later my cool app. But right here in the fascia over the pec, your pectoralis major and your deltoid, right about here over the clavicle. The fascia is just, again, a sheet of connective tissue. And from there ascends all the fibers attached to the skin. It's a skeletal muscle, remember, they're attached to the bones and skin. And in there inserts in all the lower margin of your mandible. As you can see, we're doing right at the same time surface anatomy. So insertion, insertion towards the origin, okay? What movement this muscle produces? Well, remember, yes, I'm gonna draw. I'm gonna draw just if I find my pencil. Okay, I think I'm not gonna draw. That's the direction, is right here of the fibers. So look at the fibers. They run from superior to inferior, from top to bottom. So this muscle will shorten in this direction. They cannot contract in this direction, right? So the muscle will contract in this direction. Again, you're going to move the insertion towards the origin. So what you're going to bring, you're going to lower the mandible. Now, this is a muscle that aids, that helps to lower the mandible or to depress the mandible. That's the correct term. But honestly, that happens only because of gravity. Okay, but the platysma helps in there. But the platysma also inserts on the skin right here in the corner of your mouth and inserts on the skin of your neck. So when you contract that muscle, it tenses the skin of the neck and it draws down the corner of your mouth. See? That's the platysma in action. Innervation, the facial nerve. Facial nerve, which is the seventh cranial nerve, innervates this muscle, and just so you know, all the muscles of facial expression, the most of them also attach to portions or parts of your face and makes you do this and this and this. All of those faces, facial nerve. Second muscle. So we're going to try to peel down the platysma so we can see the sternocleidomastoid muscle. This is a deeper muscle, and it's a muscle that is not located so much in the anterior plane but laterally on your neck. So let's see, remember that name of the muscle can give you clues about the attachment sites. Sternocleidomastoid. Sterno, well, yes, originates on the manubrium of the sternum. Can you see it here? This tendon in here. Sternum, head, cleido in the clavicle. Cannot see it, maybe here. Here it is. Okay, so sternocleidomastoid. Oh, mastoid, where was it? In the temporal bone, right? Right here. So, in your mastoid process. So, sternocleidomastoid. This is your sternocleidomastoid, the right and the left. So, again, look at the directions of the fibers. They run on a, following the longitudinal axis of the muscle. They are not transverse, so they cannot shorten like that. They shorten like this, not like that, like this. So what is the functions? If we contract both muscles, the right and the left, at the same time, what we're gonna do? Okay, imagine that we have the rubber band or the string, and we're gonna place one on the mastoid process and the other one right here in between the sternum and the clavicle, medial end of the clavicle. So when I shorten these strings and pulling the insertion towards the origin, what I'm gonna do, both at the same time, I am flexing the head. Now, what happens if I just contract one? What is this? The right one. So if I contract one, I can lateral flexion. This is lateral flexion, like bringing your ears towards your shoulder, lateral flexion. But I also can rotate the woo, woo, rotate your neck towards the opposite side. So 3 actions: flexion of the head, lateral flexion, and rotation, like saying no. Okay? Where's that movement happening? Huh. Atlanto-occipital, atlanto-axial articulation. Innervation accessory nerve. We're going to mention this nerve in the next week. Okay, so keep it in mind. Spinal accessory nerve. The third, well, that's the direction of the contraction. And the third muscle that we are going to describe are the scallions. The thing that we have anterior, middle, and posterior scallions. And these muscles are very cool. Look at this. I'm gonna grab my pen again. Why? Sometimes I can see it and sometimes I can't. Let's see. Yes, okay. Look at the scallion. So we have here the first rib, the second rib, right at the sternal angle, and here we have 1, 2, 3, 4, 5, 6, the seventh cervical vertebrae, right? Look at the origins. All of the scallions, the anterior, the middle, and the posterior, they originate on the transverse processes of the cervical vertebrae. Which one? I don't care. The thing is that from there, look at the belly of the muscles. From there, the muscle goes to insert the anterior in the middle and the middle into the first rib. And the posterior one, which is more posterior, on the second rib. So again, we're going to move the insertion towards the origin. So when we contract, what can we do? When we move the insertion towards the origin, we're going to pull it. Pull it. You're going to elevate the ribs. Why do you want to elevate the ribs? During inspiration, that is when you're taking in air, you need to make bigger your thoracic cavity, expand it. And in order to do that, you elevate, you raise the ribs to make it bigger. So these scallions are synergist in the respiratory movements. But what happens if I switch this? What happens if now I want the origin act as an insertion and the insertion as an origin? Now I'm going to move the cervical processes, the transverse processes of the cervical vertebrae towards the ribs, towards the first and second rib. So now if it's in one side, I'm going to do this. So this is what? Lateral flexion, and also it can do the same with rotation. So scallions are synergist to the sternocleidomastoid to lateral flex and rotate the neck. Got it? So The functions is, first of all, elevate the first two ribs, not the rest, because we just don't attach on the other ribs. And the second action is to flex and rotate the neck. Innervation, cervical nerves. We're right here in the, where the cervical nerve exits. So right there are going to come out the nerves that are supplying that those muscles. Now, right here, you're gonna find all the nerves supplying these muscles. Now, which muscle is this one? This is the mastoid process. This is the sternum. This is the clavicle. From the manubrium of the sternum to the medial end of the clavicle, all the way to the mastoid process, this is the sternocleidomastoid muscle. Remember, sternocleidomastoid and all the scallions can lateral, flex, and rotate your neck. Now, before we finish this chart, we just covered the three muscles. I want to show you my cool app. And in here, see if I can go, I hope it's big enough, doesn't fit on the screen. So, platysma. Let's describe the platysma. Here in the platysma, see, is this superficial muscle that we can see right in here. I want you to see both of them. See, this is an anterior view. This is one platysma. This is the other platysma. Like that. Okay, look at the directions of the fibers. Look at the attachment right here. It can also depress the mandible. Are you depressed? Depression of the mandible. Look in here, depression by platysma, elevation by masseter. Depression by platysma, elevation caused by the masseter. They are antagonists. Now, I'm gonna go a little bit down here. Okay, so platysma, I'm gonna turn this laterally and I'm going to remove the platysma. So now we can see deeper this muscle. Insert on the clavicle, originate actually on the clavicle. I'm sorry, this is the clavicle, the medial end of the clavicle, the manubrium of the sternum, and here we have the mastoid process. And attaches also in the occipital bone, by the way. So, what muscle is that one? The sternocleidomastoid. So, let's see the sternocleidomastoid right here. You can see the origins. It has two heads, the sternal and the clavicular head, and the insertion is on the mastoid process of the temporal bone and occipital bone. Now look at the muscle in action, and these actions that I'm going to show you here applies for sternocleidomastoid and splanus. I'm sorry, scallions. So that's lateral flexion, and in here we have rotation. See, like saying no. So lateral flexion and rotation. I don't have it here, but also remember, if you contract both at the same time, it can flex the neck. And last but not least, I'm going to now remove the sternocleidomastoid. Ta-da! And I'm going to see, whoa, can you see all that huge amount of muscles in the neck? Neck is a very complicated area. So, thanks God, we're just starting these three. So, look, I can see here, this is the first rib, and I can see here one muscle in here, one muscle in here. This is the anterior scalene, and this is the middle. And then if I remove one more layer, I'm gonna rotate it a little bit so I can see one muscle here attaching to the second rib. That's the posterior. So anterior, the middle, and the posterior scallions. Remember, actions to elevate the ribs, but also they're synergist in lateral flexion and rotation of the neck. And the innervation is given by the cervical nerves. That's it. See you in the next video. Let's describe now the muscles of the back. Actually, in here is just one, I promise.